Healthy people can build a wealthy nation. A nation's path to prosperity relies on a society that is healthy in body and mind. Mental health is of vital importance to society's well-being, which has unfortunately received insufficient attention in Sri Lanka. The impact of the near 30-year-long civil war disrupted traditional support networks in civilian life, such as family, community, and religion, which people relied on in times of distress due to displacement, relocation, and death. In the post-war era, while Sri Lanka was beginning to address the psychosocial impact from the war, the Easter Sunday attacks of April 2019 and the COVID-19 breakout of March 2020 only compounded these psychosocial concerns. And thus, the Asia Foundation looks back on how psychosocial support was provided through the USAID-funded Victims of Trauma Treatment Program known as VTTP over a period of a decade. Over the past 10 years, the Asia Foundation formed partnerships with notable international organizations as well as national authorities and local bodies to implement a range of programs. Our valued partners include the Family Rehabilitation Center, the Association for Health and Counseling known as Shantiham, Sri Lanka's Ministry of Health, Ministry of Women and Child Affairs, Ministry of Social Services, as well as the National Institute of Mental Health, the National Institute of Social Development, Sri Lanka's College of Psychiatrists, and most recently, the Judicial Services Commission. Through partners, the Family Rehabilitation Center and Shantiham, survivors of trauma were provided with services such as counseling, medical support, physiotherapy, yoga, relaxation techniques, raising awareness of the psychosocial effects of conflict-related violence, and also assisted with referrals to government and NGO services. Among the approaches of these programs, several simple but effective interventions such as befriending have been initiated with successful results. The Foundation commissioned mapping studies in 2013 and 2017 through the Ministry of Social Services and the Ministry of Women and Child Affairs to better understand the roles and practices of the government counsellors. The studies revealed the need for a standardized mental health and psychosocial support known as MHPSS approaches throughout Sri Lanka. The Foundation has worked to formalize counseling practices. Among the breakthroughs by the Asia Foundation is the pioneering of a professional guide to help service providers develop a formal client assessment tool and helping to establish a peer support group model for industry-wide professional oversight and support. The client intake form is used by both ministry and NGO partners and assesses client progress through the counseling intervention. Peer support provides a sustainable group mechanism for supervision of one's practice through peers and is mandated and used by government counsellors attached to the Ministry of Social Services and the Ministry of Women and Child Affairs. The Asia Foundation supports CPD programs for the personal and professional growth of MHPSS practitioners and to help them stay up to date with international developments in the field. Through the National Training Program on Mental Health Nursing, a partnership with the Ministry of Health and the National Institute of Mental Health, the Foundation trained 5 groups of nurses attached to acute psychiatry units throughout the country to provide quality MHPSS support to clients. The 10-day program included lectures, small group discussions, problem-based learning, and role plays. Through a partnership with the National Institute of Social Development and the Ministries of Social Services and Women and Child Affairs, 4 CPD courses for counsellors island-wide were conducted under the broad umbrella of formalizing counselling processes. This curricula is now being adapted to capacity building under a new relationship forged to work with family counsellors attached to the courts and under the Judicial Services Commission. A partnership with the Sri Lanka College of Psychiatrists offered CPD programs for practicing psychiatrists, as well as enhancing networking and referral in 5 provinces of Sri Lanka, resulting in the development of mental health provincial plans for the Western, Central, North Central, Uva, and Eastern provinces. Responding to the MHPSS needs created by the COVID-19. The VTTP, together with the Mental Health Directorate of the Ministry of Health, developed a series of trilingual self-care messages to be shared with frontline response staff through social media. These messages included content on grounding techniques, sleep hygiene, rest for the helper, managing difficult feelings, teamwork, daily commute, and digital dependence. The messages were disseminated across all 25 districts through the district's mental health focal points. The VTTP has also been engaging actively with its NGO and ministry partners to develop a range of remote psychosocial support to vulnerable groups. The support provided includes developing methodology to conduct remote counseling sessions for ongoing clients of FRC and updating the Women and Child Affairs Ministry and Social Services Ministry counselors' contact information to promote remote psychosocial support. While the results achieved over a decade show promise for the future, when reviewing the record, there is still much to be done and many miles to go. Sri Lanka's journey towards developing a society with a greater overall psychosocial well-being is a process that needs constant and careful attention to be cultivated continuously from stakeholders across the spectrum.